Hi, and welcome back to Body Beautiful. I'm Janelle Marie. We are talking with Dr. Joseph Mealy in his Walnut Creek office all about plastic surgery procedures. We've talked about a lot of great procedures. Our final one is the most interesting, I think. It's otoplasty. What is otoplasty for those that don't know?
So otoplasty literally means ear changing.
Oh.
Usually it's ear pinning, but there are other varieties of it too. Today we'll talk about ear pinning.
Yeah, who comes in for otoplasty? And I think a lot of people are maybe shy to come in for otoplasty because, you know, I don't know, they feel weird about their ears sticking out perhaps?
It's probably one of the most personal cosmetic surgeries I do, because when we look in the mirror, we see ourselves straight on.
Yes.
And that's the view we get. And
Exactly.
if you are worried about your ears, that's the view where it's the most obvious.
And since a lot of men keep their hair short, it's probably more prominent in
It's
men.
tough, yeah.
But I mean, I'm sure it's tough for men to come in and say, Doc, I need something done with my ears, right?
No, I had a man brought in by his girlfriend because
Oh.
he refused to take a promotion because he would have had to cut his hair.
Really?
So we were able to do the ear
Wow.
pinning. He thought it was a good idea. Obviously, I can't do it just because his girlfriend wants me to. He thought it was a good idea. We did the ear pinning. He could cut his hair, felt comfortable, got a promotion, so it worked out pretty well.
Worked out nicely. Let's go to the before and afters.
Sure.
People love those. We were just talking about a man. Picture number one is a man.
Right. So here's a gentleman. You can see the top of his ear stick out more than the bottom. He's got a little bit different fold on the helix, that part of the outer edge of the ear.
Yeah.
And if you were to see it from the front, he has a little bit of a bigger concha, which is the part that catches the sound.
Uh-huh.
So what I've done is reconstruct the normal folds on the ear to bring that top part in, and then set the concha back by removing a
Wow.
little bit of that cartilage and bringing it in closer to the head.
Looks beautiful.
The nice thing is it's all done from the back, so you're looking at the scars.
Wow.
So they're pretty hard to see.
Yeah, very hard to see. And let's go to picture number two as a woman. What's a downtime for a woman or man or otoplasty in general?
So I do wrap the head up for a week. So you're
Okay,
stuck with this
wow.
turban like all the way around the
Okay.
head thing for a week. And that's so that when we're sleeping, we don't move things, or certainly don't want to pull the ear forward. After the week, it comes off. Usually looks pretty good at that point. Especially if you have long hair, you can easily cover it. But even with
Easily,
short
yeah.
hair, it's pretty good. And then we have you just wear a sweatband at night. And that's, again, to keep the ears from being pulled out
Okay.
at night. But during the day, you don't have to. So.
And I see there wasn't much, it looks like maybe she had a little more on the right ear in picture number two.
So she's got, well, again, she's got that really sort of high outer part of the ear.
Yes.
So that's really, the concha wasn't the problem. It was just the fold in the ear. The antihelical
Oh, yeah.
fold didn't form completely. So just recreating that fold brings it back in. The top of the ear usually should stick out a little bit more than the bottom, but in her case, before, it was quite exaggerated.
And picture number three is interesting because it does seem like she has a problem more with one ear than the
She
other.
definitely had
Ooh.
more in the right than
Yeah.
the left. Yeah, and that also makes it more challenging because we want things to look the same.
Mm-hmm.
And trying to bend this soft cartilage without breaking it into the shape on the other side, it can be a little bit of a challenge.
Wow. Now, otoplasty, do you put the patient under general anesthesia or?
Can do
seems
it
like
either
you-
way.
Oh,
Because
okay.
you can numb the ear up pretty well with just local anesthesia.
Mm-hmm.
It's kind of annoying to get the shots. So normally I do it in the surgery center with a little bit of sedation for the numbing up part. And then we can do the procedure. The downside also to being awake is you can hear me working. So if that doesn't
Oh,
sound
yeah.
like a good idea, general anesthesia is a better idea. And again, with general anesthesia, you just go to sleep, you wake up, it's done.
And it's done.
Yeah. And I would
Uh-huh.
say it's about 50-50. Like half the people want to go to sleep, half the people don't want to know.
But at least with this, you have a choice.
Yes.
And our final picture there, doctor, what are you doing?
So the same thing, we're really setting the ears back. In his case, he had sort of an absence of the helical fold, very large concha, rotated forward, kind of all the things that cause the ears to be prominent, he had them, and we're able to bring that back and bring them in.
I have a question. If you have an oddly shaped ear, do you ever take a prosthetic and reshape the ear, give it a whole new look?
There's not really ear implants, but sometimes I will sort of make form that stays on the ear that first week to help keep it in the right shape. It's probably more common in areas where the ear is cupped or tight as opposed to just sticking out.
Our time's over already. Can
Awesome.
you believe that? Thank you again, Dr. Joseph Mealy. We are in Walnut Creek. Call the doctor 925-943-6353 or go to his websites. We'll see you next time on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.